So this is psoriasis histology. Very quick note around it. First, we'll start with parakeratosis. So we have to observe that the upper layer of the squamous epithelium does not contain any nuclei. Okay, but in this scenario, it's there. So this area will have some nuclei, as you can see here. So this is parakeratosis. Otherwise, stratum corneum is anucleate. Okay. Again, hyperkeratosis. What is hyperkeratosis? So this area, stratum spinosum, it's more than the usual thickness. So this is hyperkeratosis where stratum spinosum is thickened. Again, now stratum granulosum is reduced. So this area will not have any granules the way it has to be. So hypogranulosis, this is also called as hypogranulosis. Okay, and there is thinning of suprapapillary dermis. You can avoid this. Hypogranulosis, hyperkeratosis and parakeratosis, very important points. And usually in psoriasis, first symptom is this. First symptom is this, dilated capillaries. So here you will see dilated capillaries. This is dermal papillae, ये basement membrane, and these are dermal papillae, and dilated capillaries in this area will be there. So sometimes when straight epithelium is not thickened, the first thing to notice in any psoriasis, like early psoriasis, will be capillaries are dilated. So this is very important. Now keratinocyte proliferation, as you can see, is there, and the whole thickness, as you can see that there it's increased. So this thickness is called as acanthosis. Acanthosis, the whole thickness is increased, and as you can see there are clubbed. The normally it's like this. Okay, but here in psoriasis it's like this, bulbous. So rete are also thickened. So these are club shaped rete, and the process of the increase in the whole epithelial lining is called as acanthosis. Spongiosis is also there. As you can see, there are white area between two keratinocytes. So this is because of edema. So these areas of edema, this process is called as spongiosis. So little spongiosis is also there in psoriasis, but in the basal layer, as you can see. But in this case, I can see it here as well. So that's that. And microabscesses. So if you see the collection of neutrophils in stratum corneum, the upper layer, like this. Okay, collection of neutrophils like this. So these are microabscesses, and the terminology we use is Monro's microabscesses. Okay, and these are diagnostic of psoriasis. So this is how we diagnose the general picture of psoriasis, that it could be psoriasis only having club shaped epithelial proliferation and rete will be psoriasiform hyperplasia of epithelium. To have psoriasis, we have to look for dilated capillaries plus hypogranulosis, these two, and also microabscesses if you can find. So this is how psoriasis is diagnosed.